Good morning, Trina. How are you today?
I'm great, Robert. How are you this morning?
I am fantastic. Thank you. For those who are watching, I wanted to introduce Miss Trina Holloway. She is our North Carolina High Fidelity Wraparound Facilitator, and she has been with Thompson for quite a while. She has a very impressive background, and she's been working in our wrap space. But I would like for her to please share some of her background so we kind of have a level set on this mental health talk we're going to have.
Okay. For me, Robert, I have been with Wraparound when it was a pilot. So it was in the beginning stages. And so now we're Medicaid billable, but then we were in the pilot stages, which was a grant-based program. So I've seen a lot of changes, a lot of ebbs and flows, a lot of hiccups, a lot of adjustments that have had to be made. I am actually also credentialed as a facilitator for wraparound and credentialed as a family support partner. That is where I started as a family support partner. Along with that, I also received my national certification as a certified parents family support partner or family provider through the North Carolina's Families United. So I have kind of been around the block for a little bit. I do have history as a substance abuse clinician or intern with the Nuvia, and I have found my home here with Thompson with the wraparound program.
Wow. So that is a wealth of experience, a broad brush of experience. And I think from the standpoint of not even just mental health, but just being a spokesperson for Thompson and what we do and who we serve. I mean, I think
Yeah.
honestly, I think that you'd be a great person for that. So today's, and thank you for sharing that. So for today's
Yes.
discussion, what we really wanted to focus on was we know that we have a lot of people that see Thompson as a mental health provider of choice uh, from the standpoint of
Right.
services, addressing the needs. And we understand we understand that mental health therapy is an option. But in your
Right.
opinion, from a wellness standpoint, why is mental health therapy important? And what is it that you've witnessed and seen and worked in from that space?
Mental health wellness is important, but one thing we have to consider, oftentimes people don't realize and understand that there is something going on, right? Because they normalize behaviors, right? So once that's identified, then you can look into wellness, getting healthy, mind, body, soul, and spirit. And with wraparound services, one of our key elements is to make sure that the families and the youth come to the table with a voice and a choice. So we individualize each one of to kind of encompass the wellness and the importance of making sure that their mental health is intact, that it's stable, and whatever that includes, we encourage them. We let them sail the ship for us, right? We're just participants that help and support them. So we get their input what they feel about wellness because one of our principles is being culturally competent. So we don't go in trying to bulldoze. We go in getting the insight and input from those families so that we can help them navigate the various systems. We have tools that are in place to kind of gather data from them to kind of determine, if them managing crisis may be an issue, if them having their natural supports may be a concern, they may not have any. We help them to develop that, help them build their confidence, and help them to be able to address any wellness or mental health concerns that they may have, and whatever that may look like for them.
Okay. So you said a lot as far as as and that's a good thing because we're gonna really chop this up. So
Okay.
say I'm watching this right now and I'm at the point where I've heard that mental health therapy is important, but I don't I'm still trying to come to why it's important. And now I'm
Yeah.
like, okay, so I hear it's important, but how can it be improved through therapy? How can my own or my clients, I'm sorry, my, maybe my child, like, how
Mhm.
can, like, what can, like, step by step, like, that's kind of where we may be. So, any thoughts on that perspective?
Yes, I would tell that if it's a caregiver, be it YFS, legal guardian, or whoever, whatever that looks like, I would let them know that that would be a safe space for them to share information that they're not able to share with other people. And of course, it's going to take time, it's going to take openness from that individual, and just a matter of educating them on the benefits of seeking out mental health therapy, just to have someone that you can vent and speak with. Um, and just to let them know, by no means are you obligated to do this, but you want to, if they don't like it, they can revisit maybe seeing someone else that is more culturally fitting to them. So they have a voice and they can advocate for what they want that to look like.
Yeah, that's a fantastic answer. So, I mean, I'm hearing a lot of good things. I mean, like one of the things that you said was they have a voice and a choice. And you said that a
Mm.
couple times. And it's like they have a choice in like who they're going to work with and who they're going
Mhm.
to be, because there's a certain level of vulnerability to it. So to share that
Absolutely.
vulnerability with, right? One of the things that
Mhm.
that comes to my mind that some people may have is like, with what we do, with like our work, there is the mental health piece, and then there's sometimes maybe is like trauma, like past trauma. And so
Oh,
how do we
absolutely.
look at like the trauma and then how that affects mental wellness and mental health and marry the two? And then there's the vulnerability piece that goes with that. So, I mean, I'm sure that, what do you think?
So yeah, so on various levels, Robert, I think that it's important that we consider sometimes we get in a space and we don't realize that we've been traumatized, right? Because again, some things are normalized as we grow up. There is a tool that is being used, that's used here at Thompson is the ACEs. It's adverse childhood experiences, and that kind of gives is indicative, or it is asks questions to caregivers and about what they've seen or what they've experienced in the past. Because sometimes we end up as adults and we're like, why do I always respond that way? And I think with some trauma, there is things that have happened to us over our lifetime that we don't even realize as trauma. It's been normalized, and it's like, this is just the way I am. And I think,
Mhm.
again, with recognizing and identifying, hey, something's amiss. That is why it's important to not even dismiss trauma, because in various communities, there's a stigma associated with mental health. There's, when you say, well, oh, I've experienced trauma, you get the look like, there's nothing wrong with you. Your granddaddy acted like that. It's nothing wrong with you. Your aunties acted like that. So I think just as individuals taking ownership and accountability to get educated and find out what that looks like and how you can take ownership again of your life to say, hey, this is going to be a part of my self-care. Just like waking up in the morning brushing my teeth, I'm going to have to do a well check with myself to make sure that I'm all right, so that I'm able to support and care for the people around me.
And a big part of what you said, that's fantastic, is a big part of what I got is like destigmatizing
Yes.
the destigmatizing something that has had a stigma around it and normalizing the treatment for that, because
Right.
that is something that from a mental health standpoint treatment doesn't necessarily look like what we have as a society think that it looks like or has said that it looks like. It may look very different than what our maybe we have misconceptions around what treatment looks like.
Right.
So from that standpoint, maybe you can shed some light for people watching this on like what treatment looks like. Like again, I'm here, I've never gotten treatment, I'm a first timer. Like what does that really look like? Like in terms of meetings and what does it look like?
Okay. So what it looks like, I think, for on the back, I would say in the background, Again, identifying that there is a need and that you want to get support for that need. You would contact, of course, Thompson, Child and Family Focus, kind of schedule time to meet with someone. That first part of that, if you do not have a current comprehensive clinical assessment, and what that is, it is where you speak with a licensed clinician um, to give you a diagnosis from the DSM, from the American Psychiatric Association, right? So you have to get a diagnosis in order to be able to get mental health services started. Not, and that's where you would start. So after that comprehensive clinical assessment, they will determine what that's going to look like for you and what your next steps would be. Because again, it will be up to the individual if you want to pursue therapy, and that clinician will actually recommend if there is a particular type of therapy that will be most beneficial.
Okay.
And it starts there. It starts there. And once you as an individual has identified who you want to speak with, that could be weekly, it could be virtual, because right now in the space we're in, a lot of things are happening virtually. So those things are taken into consideration, whether it's in person, on the phone, it's virtual, and then you start building a rapport with that clinician. It's important, with me working with Wraparound, working with the caregivers, I let them know, share where you feel comfortable. Get to know that person so that when there is a challenge, you can talk to them. So this is how it would look like for that person to kind of build that rapport. Share any concerns you may have. If there's a grievance, if that person has said something to you that you don't agree with, say, hey, I don't like the way you spoke with me. That is, in essence, creating boundaries. And it's also you protecting yourself, providing yourself with some self care, some wellness, just checking in with yourself and say, you know what? I didn't like the way that made me feel. So I'm going to share and let this person know that's supposed to be helping me continue to help me.
Yeah, I mean, thank you for laying that out there, because I think that a lot of people don't maybe know, and myself included, exactly how it works. Because I mean, I'm not I'm not part of that. Can we switch gears a little bit? This is a great
Sure.
information. What about how addressing mental health would help or does help maybe some traditionally underserved populations, if you know what I mean? Like those who maybe have not had the opportunity to get what they need, from the system traditionally. Like,
Mhm.
how does addressing mental health help them?
Huh. So if I get what you're saying, it's almost as if that person that has not been in that space don't know what mental health looks like. Underserved there's a lot of disparities across various systems, right? So we
Bingo.
get that. So I'm thinking that with the underserved populations, it again, for me, it personally, it comes from a lack of knowledge. It comes from a space of saying, hey, you don't need that, just try this, and there are a lot of different methods that people can utilize. And with wraparound services, we encourage them, if you're faith-based, get supports in place. I'm thinking,
It is tough. I mean, when you think about it, there are some groups out there that have been underserved, and a lot of it's education, a lot of it's resources. So
mhm.
minority groups come to
And
mind.
finances, your proximity, what do your demographics look like, so that in itself is just like putting different categories within that underserved population, right? Because you have veterans, you have people that are involved in domestic violence. Those are considered underserved populations. And again, Robert, I think it goes back to being educated. What does mental health look like for you, right? Because we see a primary care physician, annually, right? So mental health should be a part of um, that dynamic or that lifestyle. But just getting people to understand, hey, mental health is not a that is something to get you stronger, and to help you day to day.
Yeah, and
So
it should
I hope
definitely,
that
it should.
answers the question.
Yes, I know it's a challenging question because it's such a broad, such a broad
Yeah.
question, but at the same time,
Mhm.
Thompson overall is known for providing that level of service to sometimes populations that have been underserved traditionally. So that definitely answers the question. Um, I would say at this point, I mean, you've been a wealth of resource for us. Um,
Thank
I'm sure that people are watching this will be able to take away quite a good many things. I guess if you guys have further questions, you can certainly feel free to reach out to Trina Holloway. Thank
thank
you so much for your time, Trina. We wish you a great
Thanks, Robert,
day.
for having me.
And of course, of
Okay.
course, of course. And we'll be in touch, okay? Thank you so much. Have a great
All
day.
right. Thank you. You as well. Talk to you
Bye.
later.